You are listening to the Health and Wellness Connection podcast, the #1 wellness podcast designed to provide the latest information to help you achieve your health and wellness goals. Our show features exciting guests, the latest in medical research, and in-depth discussions in current trends on weight loss, nutrition, and fitness. No matter what your interest, the Health and Wellness podcast has you covered. And now, presenting your illustrious host, Dr. Barry, MD.
Hello, and welcome to the newest episode of the Health and Wellness Connection. Now, this is your host, Dr. Barry. I'm a board-certified emergency medicine doctor as well as a health and wellness physician. So I'm here to talk about some of the latest information in the health and wellness arena. Now, this episode will be a little different, though. We'll be speaking pidgin because I want to make sure everyone is understanding the message we're talking on this show. Sometimes they complain that they say I'm talking too high level, I'm talking over people's heads. So I want to make sure this show is more available to those who want to listen. Maybe they're not understanding all the medical terminology I use sometimes. So we'll try to make it more simple so that people will follow well. All right, so again, if you have any questions about the show, maybe you hate the new way I'm speaking, or you love it anyway, please reach out and communicate with us. We like to hear from you guys. Our email is drbarryhealth@gmail.com. You can also find us on Instagram, Dr. Barry MD, as well as TikTok, Dr. Barry Health. So again, yes, thank you for listening to the show. Please share to your friends and family, anyone who may benefit from this information, which should be everybody because we're all human beings now. There's no other people who benefit mostly besides human beings, which is the whole world. So thank you. So anyways, let's move on, guys. We got some new topics today. This show should be very insightful. A lot of good information on this show. The first thing we want to discuss is that this is now Global Cancer Awareness Month, really, but Global Cancer Awareness Day is February 4th. So I know this is also the month of Valentine, but cancer awareness is also very important. And many people don't keep that in mind. But cancer is on the rise, so many more people are getting cancer diagnosis. Now, the good news is that less people are dying, but more people are being diagnosed. And we're seeing more people being diagnosed in developed countries, countries that have very high-end infrastructure and more development tend to have also more cancer. So there's a concern that may also be playing a role into the increased cancer. As more countries become developed, cancer rates are also increasing. So that's an interesting correlation that we're seeing, But let's talk about some of the details regarding this new cancer diagnosis. So now this World Health Organization report in regards to this cancer was performed, or at least performed over the past few years. But the last year was 2022 was the last year. So a little bit behind the current year, but it still gives information that we can follow and maybe make some potential conclusions from. So they said that in 2022, 20 million new cancer cases were diagnosed, 9.7 million deaths. So that shows that more people are being diagnosed than dying. However, it's concerning because there's more people being diagnosed with cancer and even younger people being diagnosed. We talk about this on the last few shows. So just want to reiterate that cancer is increasing, despite all the awareness and information we know about cancer and cancer prevention. So, and it's also showing in this report that there's not enough resources to help manage cancer treatment once it's being diagnosed. Only 39% of countries covered the basics of cancer management as part of their health plan. So many times cancer can make people go bankrupt because they have to find new money. Even if they have insurance, they're still not covered fully. So this cancer thing is messing people up very badly. So, of course, in this show, we preach prevention. Avoiding cancer is ideal, even though it's not exact. But there's many things you can do to help reduce your cancer risk, which we'll talk about briefly. We've talked about this many times, but let's talk about it small this show. Anyways, So before we go into that, though, let's talk about the kinds of cancer. So the number one cancer that's occurring worldwide is lung cancer in both men and women. 2.5 million new cases in 2022. 12.4% of all the case of cancer was lung cancer. So lung cancer, people are inhaling things, smoking things, doing all kinds of shishi and everything that's causing more inflammation in the lung, leading to more cancer. So it's very important people are aware of these things and try to reduce those activities that may increase that cancer risk. So again, lung cancer is number one killer in regards to cancer. Number two, especially for women, female breast cancer. That is the number two most common cancer. 2.3 million cases, 11.6% of total cases of cancer. Number three, colorectal cancer. 1.9 million cases of colorectal cancer, totally diagnosed, 9.6%. So this cancer of the intestine, very, very prevalent. Many people are getting sick from this and dying from colorectal cancer. Now, all these cancers can usually be discovered via screening. So, of course, since breast cancer is very common, number two cancer, or even only women, number two total cancer. So it's very important that women are going for breast screening. They're doing regular managed checking of their breasts to make sure there's no new lumps, no new abnormalities. And if they find one, you go see a doctor quick, or don't waste time. So if they catch them early, if they catch the cancer early, that is how it is treated more successfully. This is for every cancer. Early detection is key. All right, now, colorectal cancer, same thing. If you're, having blood in stool, or there's some difficulty passing stool, very possible that you could have some sort of growth that may be at risk for cancer. So doing regular screening of your rectum, as well as doing colonoscopy, that should be done 45, 50 and up every 4 to 5 years. You're having them do camera to check inside, look for anything that could be potentially cancerous. Prostate cancer is number 4. This is only in men, Prostate cancer is still a very high killer, 1.5 million cases newly diagnosed. So, of course, prostate is part of the male genitalia, okay? They call them bola. But yes, it can be very deadly if it's not diagnosed. So it's very important. If you're a man, you're getting prostate exam at least every 1 or 2 years, especially if you're over at the age of 45, 50, because those are the years when the cancer rate starts to increase significantly. So cancer has nothing to play with. And if it's not diagnosed, the rate of death is high. The good news is that if it's detected early, it can be cured in most cases. So the chance of death is much lower if you are getting regular treatment and if it's discovered early. So these cancer rates, the thing that's very interesting about how this cancer is being found is that as the rate of development in the country that you are diagnosed increases, the cancer rates are also increasing. Those countries with less development, let's say like in Africa or maybe in Asia somewhere, where they don't have as much development, meaning not as many, development, roads, buildings, whatever you like to call development, they tend to have less rates of cancer. For instance, they're looking at breast cancer, the number 2 type of cancer that people are getting and dying. The report says that people who live in high development areas, like somewhere in the West or Europe, it says that 1 in 12 women will be diagnosed with breast cancer in their lifetime, while 1 in 71 women will die from it in these areas, highly developed areas. In contrast, countries that are low development, underdeveloped, still developing, like let's say West Africa or somewhere, else, only 1 in 27 women will be diagnosed with breast cancer. So almost 50% less likely in lower developed areas you'll be diagnosed with breast cancer than you were in high developed areas. But however, if you do develop cancer in those low developed countries, due to lack of health care, there's a much higher risk of dying. So it's a good and bad. So it's just a very complex situation, But we know that because of cancer is likely due to overexposure to harmful carcinogens, especially many chemicals. We talk about forever chemicals that they have in plastics, or all these other potential things that are used every day. All these things are increasing cancer risk. We know that these things are more prevalent in people who are in developed countries. For instance, if you're in an undeveloped country, there's a chance that you're getting your water from the stream. You just go to the stream, pick water from the stream, and then you drink it. Meanwhile, if you're in a developed country, you're getting bottled water, or you're going through some water treatment plant where they put all things in the water to treat it, quote unquote. But you don't know if it's potentially carcinogens they're using. So development thing is very tricky, but no one says development is bad. Development is good, but we have to be sure to avoid those things that are cancer causing. Even if we're developed, we don't need more cancer, I beg. So cancer is still something that is very, very important, very serious, and causing much death throughout the land. So again, please guys, being that it's World Cancer Month and World Cancer Day was on the 4th of February, please take a moment to ensure that you're keeping all of the potential preventative things to help reduce your cancer risk by going for your screenings, reducing exposure to cancer-causing activities, and just taking care of your bodies. Thank you. Okay, guys, the next topic is a new interesting study talking about sitting down. People that sit down too much, there's a big increase in cardiovascular death and all-cause mortality. So if you're in a job where you're sitting from 9 to 5, 12 hours, you're sitting down in one place, you're not moving around, the chance of you dying is much higher, almost more than 1/3 than those who are not sitting as much. So if you're in a job where you're moving around, you're maybe bricklayer, you're doing gardening, you're moving up and down, those type of jobs tend to have a better overall long health profile. Those who are sitting in one spot from morning to night, not moving, those jobs can be very, very deadly over the long term. So it's very, very important that if you're doing any kind of work where they walk out, they sit in one place from morning to night, you're slowly killing yourself, or it's very deadly. So this study that talks about this is very interesting. There was a study that almost included 500,000 people, right? The mean age was 39 years, meaning the average age of all those people in the study was 39 years of age, 53% women. This happened in Taiwan. So this is a Taiwan from Asia, where they looked at people who were in a job that they sat a lot versus those who were active and moving around in their work. They found that after following up on these people 13 years after the period of the study, they found that more than half of those people who died were those who were working jobs where they sat the majority of the time. And most people who died of cardiovascular deaths, so heart attack, stroke, and other things affecting the heart. So, and they eliminated all the other potential concerns like smoking and drinking and everything else. And they found that the sitting was one of the most deadliest causes of increased risk of death from cardiovascular causes. So, and when we say people who sitting, meaning less than 15 minutes a day of activity. So there's some people who don't even move. They just may stand up to eat, sit down. So less than 15 minutes is very small though. So you guys who are in jobs where you're not moving around a lot, let's say you're doing a call center job, you're doing maybe a job where you're sitting in one space, accountants or some business person, try and get up every few hours, move around, 10-minute break, 15-minute break, you're doing a walk or something where you're moving the blood, you're being you're doing activity. Of course, it's best also to consider doing a regular workout routine, maybe before or after work, to help keep the, health strength improved. So again, sitting down is almost as deadly as eating, bad food or smoking or doing something that can be very, very harmful. So again, be active, or it can save your life, especially if you're someone who sits a lot for their job. Okay, now speaking of healthy lifestyle, we have established repeatedly on this show that sitting too much is very deadly. But now we're seeing that being active, being healthy, having regular exercise, eating fruits and vegetables, reducing alcohol consumption, and other things that are associated with healthy lifestyle is associated with better cognitive function, meaning brain, they work better, So if you want to be old and intelligent, you have your memory, you're knowing what's going on, you want to engage in healthy lifestyle when you are young. You don't want to wait till you become old and you start trying to be healthy. By that time, it's too late. Oh, the damage is already done. Oh. You want to be sure that as you're living, you're trying to maintain healthy activity so that as you age, you can help improve your chances of better brain function. All right. Now, it's found that those people who did these things, who were very active, who tried to reduce harmful activities, they found that they had decreased levels of Alzheimer's, which is the disease that they cause you to lose your brain completely. You want to have no memory of what is going on. It's not very good though when you don't know what things that happen from 1 minute to the next. Someone will tell you something, you just forget 5 minutes, you don't remember again. That's the problem with Alzheimer's. It can be very, very devastating. So to reduce this, a healthy lifestyle can be beneficial. Now, the study was published in JAMA Neurology. That is a very important very important medical journal. Now, this study was very small shop, but it was still very insightful. So we'll discuss it. The study was only 586 people, 71% female, and they followed them from 1997 to 2022. So almost 25 years. So a good length of time monitoring people to see how their lifestyle affected their development and their brain as they aged. And they found that those who had a healthy lifestyle, meaning that they exercised moderately, about 150 minutes per week, so not too bad, maybe 30 minutes, 3 to 4 times a week. They didn't smoke. They only consumed a few drinks per week, and they played, card games or whatnot. They found that those who had more healthy lifestyle activities had a much, much lower risk of developing Alzheimer's or decreased brain dysfunction. So this study, while small, is very powerful, and it showed monitoring people over a long period was definitely beneficial as far as healthy lifestyle choices, as opposed to those who engaged in more destructive choices that can potentially affect brain health. So overall, it's clear that healthy lifestyle can help improve brain health as we age. And I know everyone wants to be intelligent and sharp as they age. You don't want to lose your mind as you get old. So a healthy lifestyle now can help prevent brain dysfunction as you get older. Okay, guys, so the next topic, it talks about weight loss treatments and blood pressure. So we discussed plenty of time about how weight loss, if it's lowered, can help reduce blood pressure. Blood pressure is usually a side effect of obesity as well as other potential dysfunctions in the body. However, there's new information showing that if you are losing weight, especially with the help of weight loss intervention like injections of all these appetite suppressants, we call them GLP-1 inhibitors. So if we do things that help reduce weight, we can reduce blood pressure significantly to the point of maybe even getting patients to stop taking these medications for blood pressure. So the recent study showed that if you're someone who's suffering from obesity, meaning you're too much weight, and you want to reduce your blood pressure, one of the best things to do is to consider doing some weight loss treatment, be it injections of the GLP-1 or these weight loss drugs, or even getting surgery like bariatric surgery where they restrict the stomach so you're not able to eat as much as you would like, which will hopefully reduce your calorie intake, which will hopefully reduce your weight. So this study was published in the American Heart Association Journal for Hypertension. They used one drug called tirzepatide. So it's a common drug used for obesity, similar to this Wegovy and this Mounjaro and all the other ones that are very popular, Ozempic, similar to those drugs. So they used it in patients where they injected the patients once per week. They did it over a period of 9 months. And they found that over the period of 9 months, those who received those injections lost almost 22% of their weight. So very significant weight loss. And that's why the drug has become so popular, because people are actually losing weight. And they saw that also those who also lost weight also had a significant drop in their blood pressure for an average drop of 7.4 millimeters mercury. So that's very significant, Shy. If you're someone who has blood pressure at a certain level and it drops almost 7-8 points, that could be the difference between taking medication and no medication. So that's even more, that's more effective than even the medication itself. So if you're obese, taking blood pressure pill, most times you don't even get enough of a drop. That's why many times people have to take 2 and 3 and 4 pills to get an effective blood pressure reduction. However, those who lost weight were also getting very, very big drops in their blood pressure. So this is why these drugs are becoming so popular, these weight loss drugs, because you can sometimes stop many different types of drugs, including diabetes drugs and blood pressure pills, if you lose enough weight. So ultimately, this study is another strong study looking at the effectiveness of reducing obesity. Now, I'm not saying you need these drugs, though. The drugs aren't essential. You can lose weight without these drugs. And many people are even shaming people, drug shaming people, because they use these drugs to lose weight. It's not good, though. You should be able to celebrate someone if they lose weight via drug or they lose weight via diet exercise. So ultimately, it's very important that weight reduction is key when it comes to healthy lifestyle. Because when you drop your blood pressure, you have decreased risk of brain injury, decreased risk of heart attack, decreased risk of stroke, and many other issues. So this study also looked at weight loss surgery. So those who don't want to do the injection, instead they prefer surgery, which I don't understand why, but some people think that surgery is more effective, is the people who went bariatric surgery, which is when they remove part of the stomach to help you reduce your intake. Those people also lost weight. And they also were able to lose or decrease their blood pressure. They say that in this study particularly, they looked at only 100 people because not too many people are doing the surgery. It's not everywhere. But they found that 80% of those who had the surgery were able to reduce the number of blood pressure pills they were taking versus 14% of those who were only taking medications. So again, this showing that if you lose weight, it can help reduce the need to take many of these medications that you're using to treat blood pressure and everything else. So again, blood pressure has a huge relationship to obesity. So if you're obese and you have high blood pressure, chances are if you lose that weight, you also lose that high blood pressure diagnosis. And because obesity is becoming so prevalent, especially in America, where many people tend to have too much food access, that blood pressure issue can potentially be solved by potentially losing weight. So I encourage you, if you're someone who's tried to lose weight and you have many other medical problems, consider doing something to help with the weight loss. These injections can be very effective, and especially if you're already sick, it can be very beneficial to helping long-term health quality. Hey guys, so new information on vitamin D is coming out. Now remember, vitamin D was one of those vitamins that was kind of under the radar before, and many people didn't even know vitamin D. They didn't really they didn't care for vitamin D until COVID came out, and they showed that vitamin D can be very helpful in reducing inflammation. It was found that those who had high levels of vitamin D did better with COVID and COVID infection. So now they've done more research and started to explore vitamin D more. And there's new data to suggest that vitamin D supplementation may be helpful in reducing the risk of autoimmune diseases. Diseases like inflammatory bowel, Crohn's disease, lupus, and other infections and problems that are due to too much inflammation. It appears that vitamin D may be helpful in reducing those diseases from developing, as well as the severity of those diseases when they develop. So there was a study they called Weightl, where they looked at the effects of vitamin D supplementation on cancer and heart risk. And they found that those who were supplemented with vitamin D during their treatment for cancer and cardiovascular disease, they found that those who were taking vitamin D had a 22% reduction in autoimmune disease development. So that's very important, because we know vitamin D is, again, very helpful in reducing inflammation and helping the body reduce inflammation overall. Study, what we said, the Weightl study, which is where they looked at this vitamin D supplementation, very good study. They used 25,800 people who enrolled in the study, about half men, half women. Again, the ages were about 50 to 55 and up, so a little older population. And they looked at those who received the vitamin D and those who did not. Who were in the group that did not receive vitamin D had increased risk of autoimmune disease development. Now, the rates were very small, 12 out of 12,234 people developed autoimmune disease in the group that received vitamin D versus 280 people developed autoimmune diseases in those who developed placebo. So slight difference, about 15% reduction in the development of autoimmune diseases in those people who were taking vitamin D. So vitamin D is definitely helpful. It's still better lifestyle modification. So if you're someone doing things that can affect your inflammation, smoking, taking too much sugar, not exercising, not sleeping, all these things can help. They can worsen inflammation, which can potentially increase risk for autoimmune development. So vitamin D can be helpful and can be a very important part of nutrition supplementation. Someone who making sure you want vitamin D in your diet, places where you can get vitamin D naturally include mushrooms, salmon, fish, salmon especially, but other fishes, cheese, egg yolk, tuna, cod liver oil, beef liver, orange juice. Those are all good sources of vitamin D. So ensure that you're getting good vitamin D in your diet. And if you're not getting it, maybe you would take multivitamin to help improve your vitamin D level so you help reduce that inflammation risk. Okay, guys, so a very interesting study also I saw tied to looked at OCD, obsessive compulsive disorder. Obsessive compulsive disorder is a condition that people who obsessively who obsess over things in their life, be it things that is happening in their life, things they're doing, other people, things that they're just extremely compulsively obsessed over every little thing. It can be associated with increased risk of death from all causes, both natural and unnatural. So it's very interesting. So still confused. OCD is something that people have just uncontrollable, reoccurring thoughts and obsessions. They engage in repetitive behavior. They just can't relax. They don't know how to calm down. They worry too much about small things, and they don't stop worrying until it becomes a problem. Now, these people who tend to have all this obsessive compulsive disorder behavior, increased risk of death from all causes. So let's talk about it. So the study looked at a population of about 61,000 people. This took place in Sweden, is where the study was done. And they found that people who were diagnosed with OCD, they found that people who had OCD tended to have higher levels of death of all causes. And of all causes of death, suicide was the most common. So almost, very concerning, because people who are so compulsive tend also to be overly concerned about things that may not be that serious, to the point where they don't want to kill themselves due to depression or feelings of hopelessness. So this shows the danger of, too much stress, too much compulsion, ultimately can lead to even suicide, which is the number one cause of death in this group, according to this study. Now, they also found that accidents were big as well. So if you're overly compulsive, you're not focused, you can potentially have an accident that can result in death. So, and they said almost all causes of death were higher in the OCD versus non-OCD, including nutritional, metabolic diseases, mental and behavioral disorders, heart problems, nervous problems, respiratory problems. So everything was potentially increased as far as risk of death or bad outcomes due to OCD diagnosis. So if anything, hopefully this will tell you or give you idea that you should be calming down when you're worried about something, because too much worry, too much compulsion can cause increased death from all causes. Okay, guys, so new information don't come over regarding erectile dysfunction. Erectile dysfunction is a disease or a condition that has affected many men all over the globe, meaning inability to get an erection. So this can cause many people to be depressed, have issues, and life is no longer sweet. But because of these new medications that are on the market to help treat this condition, like Viagra or Cialis, many men have found ability to now resume sexual activity. So, of course, this because makes the drugs very popular now. However, there's new research showing that it's possible that these drugs can also help reduce Alzheimer's disease or that cognitive decline. Now, a new study that was done, they looked at a large group of guys, 250,000 men. So very, very big study. This was done in University of London, UK. So UK working overtime to ensure that these drugs are fully investigated. So they looked at 250,000 men, and they saw those who were using these Viagra, these drugs to help with sexual problems. And they found that those taking these drugs had decreased risk of developing Alzheimer's dementia. So imagine you're now having sex, you're now doing better in the bedroom, but you're now able to remember it longer. So it's a good thing for everyone, especially those who are using the drug. Now, of course, they found that those who were taking the drug, they followed them for 5 years after they started taking the drug, and they found that those who were taking the drug had a decreased development of Alzheimer's dementia. Now, they were able to eliminate some other risk factors like smoking, alcohol use, and obesity, and everything else that are also known to affect erectile issues. And they normalize them to only separate against those taking the drug. And what they found was that, again, those taking these drugs had a much lower development of Alzheimer's dementia. So this potentially could mean that these drugs potentially could be used to treat those people taking or having Alzheimer's potentially. Now, they say they need to do more data to analyze to see if whether or not this is a true link or just potential, coincidence. But, we know that Alzheimer's and dementia can be associated with blood flow to the brain and maybe blockages or small strokes that they occur that's affecting the brain's ability to function well. So if these drugs can help improve blood flow to the brain, which can overall reduce risk of dementia, it's very possible that these drugs may be now used outside of just erectile dysfunction. They also saw that lower Alzheimer's risk was found in patients with men who had hypertension, diabetes, and those who are 70 years and older. So they found this Alzheimer's improvement in older men, not necessarily younger men. So if you didn't have diabetes or high blood pressure, there was no real benefit as far as your brain development with taking these drugs, as opposed to the older men who had these conditions. They found that they were the ones who benefited most as far as the protection of the brain decline. So again, these drugs are already popular, will now potentially gain more popularity as people are now seeing that in addition to improve Benny's function, they're also getting improved brain function. So science is good, I'm telling you. So again, guys, before you start taking these and abusing these drugs, saying you want to become smarter, go and talk to your doctor. Or it doesn't help young men, or you want to use them past exam. You think your brain will become more sharp because you're taking Cialis. It's not like that. Or only for older men this thing used to work. Younger men may not benefit as far as any brain development. Now, erectile dysfunction will benefit everyone, but again, Cialis and these other Viagras may be helpful in reducing the risk of dementia in older men who are taking these medications. Okay, guys, and last but not least, on the lifestyle side of things, a new study came out that showed that married people tend to be far happier than those who are not, according to new data. Now, this data was done via a poll, so not necessarily any kind of observational study. They just asked people who are married, those who are not married, asked them questions to see who was happy and who was not. Now, the thing is, this is self-reported data, so people who are just talking to the researchers, telling them their life and telling them their happiness level. Who knows if their wife was next to them, or so maybe they're lying, you don't know, but the data we received is showing that those who are married said they were consistently more happier than those who were single. So let's talk about it. So they looked at people from 2009 to 2023, almost 2.5 million people. So very, very large study, which is giving that helps with the accuracy of the information. This was done in the United States. And they said, how would they rate their life from 0 being the worst to 10 being the highest? And so, they looked at people who just answered this question, and they found that those who were married had consistently higher levels of happiness compared to people who were not married. Almost 12 to 24% higher, depending on the year. Again, this was from 2009 to 2023, so almost 24 years of information that they collected. And so this is good in the sense that there's a large number of people as well as a large length of time. So it can help eliminate those who may have been lying or who were under duress. Maybe the wife was behind them looking crazy, threatening them, so they have to lie, vice versa. Even the women who are lying because their husbands are looking at them crazy. So that's why I do think the study does have some merit, Sha. So they found that those who are married tend to have higher overall levels of happiness. We know happiness can help improve longevity, improve your energy level, make you more motivated to do things and improve your life. So happiness is good. So if you think that if we've seen that marriage is helping people become happier, then we have to say marriage is also good, Sha. So I know many people now who are single will be protesting, saying it's a lie, not be true. It's not accurate, but hey, you can't argue with the numbers. So according to this data, getting married may be the way to become happier. Now, some people who are married who are very upset, depressed may disagree, and we can see that because divorce is also very high. So people are getting divorced, especially in the Western world, though. So ultimately, people who think getting divorced may improve their happiness may be in for a rude awakening based on the data. It seems that those who are still married tend to be happier than those who are not. So just take it for what you will there. Well, anyways, that's the end of the show today, guys. Again, this week, the information was there. There wasn't as many nice articles as I like, but we had some good information. So please share. If you have any questions regarding any of the discussions we had today, please reach out. Let us know what you think. Any feedback is greatly appreciated. Again, email drbarryhealth@gmail.com. You can find me on Instagram as well, Dr. Barry MD. And last but not least, TikTok, Dr. Barry Health. Okay, guys, until next time, we will see you. Peace.
Thank you for listening to the Health and Wellness Connection podcast and radio show. For more information on ways to get healthy, please check us out. www.anchor.fm/HW Connection. Here you can re-listen to the show, check out older shows, and even further support the show by becoming a subscriber to the podcast. Please check us out today. Again, that's anchor.fm/HW Connection. And also, don't forget to follow Dr. Barry on Instagram at drbarrymd. Until next time, stay healthy.